How's it going, everybody? It's Dr. Jeff, Rythmia Life Advancement Center. I'm the Chief Medical Officer down there. I happen to be in California right now, waiting out this pandemic. But I'm heading down actually in a couple weeks, so I'm excited to get back down to Costa Rica, get Rythmia cracking again. Hopefully you guys can all come down and visit. As soon as all this stuff changes and shifts and we can travel again, everything's cool. Hopefully you guys are doing all right. So today's topic is one that I really dig, and it's called, I named it Symptoms versus Cause. Now, the reason I love this topic is because so many people are suffering with a variety of different conditions. And me, being in the mental health field, I deal a lot with anxiety and depression with people and addiction. And I deal with acute psychiatric conditions. And I deal a lot with trauma and a lot of different personality disorders and all this kind of stuff. And what tends to happen for a lot of people that seek treatment for mental health issues. Now, when I say mental health issues, we can all relate to mental health issues in one way or another. We might not be diagnostically depressed and meet criteria, but we go through times of depression for sure. Everybody does, right? So we can all relate to mental health issues. So what happens if somebody is severely anxious and severely depressed at the same time, they tend to be suicidal. And the symptoms that a person that's very depressed and very anxious might have are sadness, hopelessness, maybe self-harming behavior, maybe a drug or alcohol issue. Maybe they're not getting out of bed. Maybe they are crying all the time. There's a lot of different things. And those are what we would call symptoms, right? Those are what's happening. That's what the person is expressing, right? To show their emotion, like how they're feeling inside, it's coming out, right? And what we want to do with somebody is initially look at the symptoms, because that helps point us in the right direction of like what might be going on with somebody. So if I am a clinical person and I notice that somebody has sadness and anxiety, well, I'm really concerned about that person. So we have to quickly resolve some of those symptoms and lessen them. So what you guys are used to seeing in Western medicine is psychiatrists will give you meds, right? And they'll give you meds even if you're not in crisis sometimes. We all know, right? Like meds get thrown around a lot. 85, you guys are going to love this statistic, 85% of all psychotropic medication is prescribed by non-psychiatrists, okay? Now that's a crazy statistic. So what that means is that family practice doctors, internal medicine doctors, mostly them, but really any medical doctor, whether it's your OBGYN or whether it's your pediatrician or whatever, they can prescribe all the psychotropic medication. And psychotropic medication are the antidepressants, the anti-anxieties, the ADHD meds, all the meds that are related to mood and related to mental health issues. So somebody, a medical doctor, like that's not a psychiatrist, didn't do too long of a rotation through the psych unit or the psych rotation. Some of them, it was just a couple weeks. And all of a sudden, they're qualified from the AMA to prescribe psychotropic meds. Now, clearly, over a physician's career, no matter what field they're in, they can get continuing ed hours that are more psychotropic related, and they can get more psych experience, and they can do fellowships, and they can enhance their awareness of mental health if they're an internal medicine doctor, for sure. And a lot do. However, the psychiatrists are the ones that know the most about the psychotropic medication. That's their area of expertise. They did years and years and years of study in that area to understand those meds. Now, with that being said, obviously, psychiatrists can still overprescribe meds and not look at the real reason for things. Of course, absolutely. But I trust a psychiatrist prescribing meds more than I trust a family practice doctor prescribing Wellbutrin. I just do. Now, what if that family practice doctor has 30 years experience and they've dealt with a lot? They've taken a lot of fellowship hours and a lot of different stuff in psych rotations, then they are also appropriate. So, not like, as you guys know, I like to say not black and white. There's a lot of gray in healthcare, a lot of gray. So, back to the topic. So what happens is people that are anxious and depressed get prescribed meds. And then what tends to happen, because I've seen it, is that person doesn't always do the therapy or the groups or the change of life skills or the enhancement of behaviors that they're supposed to do while they're on those meds. What the protocol is for meds that are related to depression and anxiety is that somebody should be on those meds for no more than 18 months. And during those 18 months, they should learn life skills and they should do some therapy and they should get some self-esteem up and they should talk to other people and they should basically change their behavior. And the meds help give them a foothold. That's the goal. Now, that's not what happens. We all know meds tend to be ineffective very quickly. Then you need another med. And eventually somebody is hooked on these meds to some degree. And they got to taper off these meds. And that's really hard. It's super hard. And a lot of doctors don't want to help you taper off these meds because if something goes wrong, they might be liable and they're nervous about it. And the bottom line is a lot of healthcare professionals don't have the confidence that you can actually change. That's just the reality. I wish it was different. But what happens is healthcare professionals are caught in a system that is very, very, very antiquated, and it's also money driven and capitalistic driven. And so what happens is the doctors start off being really excited and helping people and this and that. Then they see that their hands are tied from liability, and they see that they're unable to really practice medicine the way that they've always wished and hoped and dreamed. And they just get locked into the system, and then they have to survive. So I'm not blaming individual medical doctors. I'm not blaming individual psychologists, therapists. I'm blaming the system that is locking these individuals in. The system sucks. So what happens then, ideally, is that person gets on meds for a little while. They're supposed to change their behavior, supposed to do some therapy, and then they're supposed to get off those meds. And then they've changed and they've realized the underlying cause of their anxiety and their underlying cause of their depression. That's what's supposed to happen. They've worked through it. Maybe it was trauma-based. Maybe it was neurochemical-based. Maybe it was life situation. Maybe a family member passed. Maybe they lost their job. Maybe they went through a divorce. Maybe there's circumstances, right, that they feel upset about that they had to work through. And those are the underlying causes of what's propelling the emotional situation. So a lot of people have trauma, and trauma is something that is very difficult to work through in a traditional Western medical way. It just is. It's totally doable, but it's just hard. And there's a lot of hard work involved. And there's a lot of money involved. There's a lot of therapy involved. And there's often meds involved. And it's not easy. It is totally doable because I've walked clients through it myself. And it's doable. However, it's just not accessible or available to a lot of people that need it. So how do you work on the underlying causes of anxiety and depression and addiction and all mental health issues? How do you work on them if you can't afford the treatment, you can't afford the way that it's supposed to go, maybe don't even have health insurance, right? How are you supposed to get this to occur? Well, it's not easy. And what I've basically changed my whole career to focus on in the last 10 years is plant medicine, because plant medicine helps work on the underlying causes of all these different issues. Rythmia believes that all disease, all illness, all anxiety, all depression, all addiction, all mental health issues are a result of being split from your physical body and your emotional self. There's a split. And we believe that during that split, in that dissociation, that's where all of these issues occur. and you have anxiety and depression and addiction and sadness and disease and illness and all this stuff because you're unplugged from yourself. And so how do you plug back into yourself so you can help yourself? You can get clarity. You can process emotional trauma. You can overcome all kinds of stuff. How do you do it? How do you do this? There's lots of ways. There's more ways than we can even talk about in this Facebook Live. There's thousands of ways. The way that I am basically advocating, and the way that I have learned and seen and know that is very effective and very safe and works for a lot of people, is plant medicine. It works very well because it's quick, it's effective, and what's happening now, people always say, well, yeah, this ayahuasca, and they have a trip and they've da-da-da-da, they figure, whatever. What's really going on? Okay, what is really going on with this? Because that's why I'm involved in Rythmia, because I can tell you guys the science, the therapeutic side, the medical side, what's actually happening when I take ayahuasca. What is actually going down? Well, aside from all the neurochemical stuff that I always talk about, and the dimethyltryptamine that I always talk about, which is the active ingredient, and all the different sort of neurochemical response and amygdala and prefrontal cortex and all that stuff that I talk about in previous Facebook Lives, you guys can look up on YouTube. Aside from that, what's going on is that you have an experience where you get out of your own way and you can see what you are doing for yourself, and you can give yourself that advice that you give so easily to everybody else about what's wrong with their life, and you can see what's happening with somebody else. You get to do that with yourself. You get to see from a third person perspective, in a sense, what you're doing wrong or what happened to you that's causing these issues. Whether it was trauma, whether you have a certain behavioral tool that's not serving you any longer. Maybe you have an anger issue that you're not aware of, and it's affecting your relationships, and it's affecting your own peace of mind, right? But you're in it day to day, so you don't see it. You drink ayahuasca, and then you step back from it, and you get to observe it, and you get these clarity breakthroughs that occur. And the reason that it happens is because of the active ingredient of dimethyltryptamine. That's what occurs, and that's what allows this experience to happen. So it's very therapeutic. Like I said just a few seconds ago, you guys are all great at giving advice to people. Your friends, your family, even strangers ask you all the time, why is this not so good in my life, and why can't this happen? You have the greatest advice ever. You say, well, this is why, and you're doing this, and you're doing that, and maybe you should try that. And then the person does, and like, oh my gosh, you're so right. You're so insightful. How did you know? Well, that's what you get to do for yourself when you do ayahuasca at Rythmia. That's what happens. You get to give yourself that advice that you've been given to everybody else so well for so long. Now you can do it for you. You can resolve the underlying causes. Now, when I was in Malibu working at a rehab called Passages, which is a really cool place, we looked at the underlying causes of people's addiction. I saw it work really well there because in addiction, and I'm not knocking the other models. Every model has its benefits. The underlying cause model, the 12-step model, the abstinence model, the harm reduction model. All the different models of addiction have benefit and work for some people, and some people they don't. So it's just kind of like what works for you, right? But the Passages model was, we're not going to look at alcohol, for example, as the problem, because that problem is going to be around you the rest of your life. It's everywhere. Unless you move to some deserted island. Even there you can probably make it with coconuts. Okay, so it's always around. So alcohol is not the problem. The problem is that you feel that you have low self-esteem. You feel less than. You feel not worthy. You feel traumatized from your childhood. You feel that you're not a good person. Okay, those are the underlying reasons that you're drinking. That's the reason. It's not the alcohol. We all know alcohol tastes like shit. Nobody really likes it. I'm sorry if I offended somebody who loves whiskey. All my Ireland peeps. Okay, but bottom line is, nobody needs to drink alcohol. Okay, so with somebody that has an addiction, it's not the freaking alcohol. It's these underlying issues that are not worked out, that are eating at us, that we're trying to avoid. They're trying to buffer. They're trying to block. And alcohol is a tool. There's other tools to block things too. And people that go an addiction road do that. And so that's an example of looking at the causes of things. Okay, what's really propelling and driving the symptoms and the behavior, right? What is the underlying issue? So I love this topic because we can look at it in all different issues. Like if I'm always irritated and have a short temper, why is that? Is that just because everything sucks around me? Is that because like nobody's doing things right? Or is that because I don't have enough time in my life? Is that because my coworkers or my wife are not, doing their part? No, that's not why. That's not why. The reason I have a short temper and I'm quick to get pissed off, let's say as an example, is because I feel upset inside about myself, right? And there's reasons for that. And what are they? Well, maybe I don't feel like I'm doing a good job. Maybe I don't feel like I'm happy inside. There's all these things. So plant medicine helps to go in and look at, see what that is, and gets clarity on it, and you push through it. And it gives you these tools and these awarenesses that then you start to instill in your life. So if somebody has an addiction and they resolve their trauma and they resolve their self-esteem issues, then they have to do things that boost self-esteem. Then they have to behaviorally stay away from the alcohol influencing vibes that are around them back home. Then they have to start to engage in other activities. So there's work to be done, but it's a good work. It's not really work. It's just like living. It's like living healthy. People say, oh, there's a lot of work to do. Well, it's not really work. It's just living. It's like people how they say when you have kids, if you've never had kids and you have a kid, oh, it's a lot of work. Well, I don't call it that. I call it's just living. It's like living. It's like life. Like life, if you have a kid, then that's just part of your life, and it's just becomes your life. So I just kind of look at things a little differently. I don't think it's work when it's something that's beneficial for you. So the tools you get on plant medicine are beneficial, and you get to step out of your own vibe and look at you and see what's up. So let's look at the symptoms to get a perspective, a point of reference. Then let's treat the underlying cause. If the symptoms are severe, let's remedy the symptoms a bit to get the person feeling comfortable and not as extreme and maybe not as high risk. And then let's start to look at the underlying causes. And let's use these things together as tools in the mental health field and in your own life so you can improve and feel better about yourself. Rythmia is really good at doing this. Very, very good. That's a huge part of what we're doing down there. So please come down and check it out. If you can't afford it, go to our Rythmia Facebook page, fill out the scholarship application. Because if you want to get there, you're going to get there one way or the other. All right, guys, pura vida. Happy Memorial Day for those in the United States. For everybody else, happy Monday. See you guys next week. Pura vida. Dr. Jeff signing out.